So welcome, everybody. I'm Tazeen Hassan. I'm a Senior Private Sector Development Specialist with Women, Business and the Law at the World Bank Group. And we're very lucky today to have two leading experts in the area of child marriage, both having different perspectives on this issue from both the kind of education, early education perspective and also the health perspective. So I'll start with women first. And so on my left, I have Margareta Norris Harrit, who is a Senior Health, Nutrition and Population Operations Specialist at the World Bank Group. She is a task team leader of the Sahel Women Empowerment and Demographic Dividend Project, which is being implemented in 6 countries in West Africa: Burkina Faso, Chad, Cote d'Ivoire, Mali, Mauritania, and Niger. She joined the bank in 2010 after 6 years with McKinsey & Company, where she launched the firm's global health systems practice, serving clients in Africa, Europe, and the Middle East and China. And to my right, we have Quentin Wodon, who is a lead economist in the World Bank's education global practice, where he leads the work on equity and inclusion in education, out-of-school children, and child marriage. He's worked on areas ranging from human development and infrastructure to public finance and poverty and gender in many regions across the world: Africa, Asia, Europe, Latin America, and North America. And he's proud to be a lifelong learner. He holds graduate degrees in business, engineering, economics, and philosophy, and PhDs in economics and theology and religious studies. So that's kind of exhausted me just to say that. But if we start first with Quentin, perhaps you can give us an overview of your work in this area.
Thank you, Tazeen. We started about 2 years ago a research program jointly managed by the World Bank and the International Center for Research on Women on trying to assess what the economic cost of child marriage is. And I should perhaps tell you why we are doing this, and then some of the main results very quickly. So the reason why is that on an ethical basis, we are all probably convinced that child marriage is a very bad practice for the girls and for the children of those young girls who get married early. There is now much more of a consensus on trying to end child marriage. It's part of the Sustainable Development Goals. But at the same time, even though more countries are putting together strategies to end child marriage, the level of funding and the level of program interventions that are put together to end the practice remains very low. And the program that Margareta manages at the bank, the SWED on our side is one of the first big projects to fight child marriage. So we thought with ICRW, the Center for Research on Women, that we should try to estimate the development and economic impact of the practice. So what does it mean for fertility? What does it mean for under 5 malnutrition, under 5 mortality? What does it mean for the education of the girls? What does it mean for what is called intimate partner violence, for decision-making of women, for access to land, a wide range of different domains. So we are trying to use data to estimate the impact of child marriage on all those different domains and what the associated economic cost is. And what I can tell you, although we have not yet released numbers, is that the cost per year is in the hundreds of billions of dollars. And what we hope is that by presenting this evidence to ministries of finance, as well as line ministries, education, health, and so on, we will be able to have a stronger advocacy for more interventions, better interventions that would help end child marriage. So it's essentially making the economic argument for this beyond what we probably are all convinced the moral argument for ending the practice. Should I go further, or this is enough?
Thank you very much, Quentin. So that's, I think, a great start to the session. So I now turn to Margareta, perhaps, to give her perspectives on this issue.
Thank you very much. So the SWED, the Sahel Women Empowerment and Demographic Dividend Project, is a regional project. It was the first regional project, IDA project, that wasn't an infrastructure project. It's a collaboration between health, nutrition and population, global practice, social protection, gender, education. As we collaborate internally, of course, more importantly, clients are collaborating across ministries in the 6 client countries. And this is critical because what we're trying to achieve is impossible if it's done by a single sector only. The entire project targets adolescent girls and women, 10 to 19 years old. It's structured around 3 main strategies, looking at how to improve reproductive health, maternal health, child health, adolescent health services, looking at it both from a demand side as well as supply, of course, and then more around the political environment, enabling environment around it. Typically, from the health sector, when we talk about reducing fertility in very high fertility countries, there's been a strong focus on supply side, on contraceptives. Of course, especially in West Africa and certainly in many other countries as well, the reasons for early marriage and early childbearing is very much founded in traditions, in culture, in religion, in practices that aren't just informed or basis on whether you have access to contraceptives. It's really based on long-standing traditions and much harder to change as well. So a strong focus of the project is really around empowerment and an empowerment of young girls to have options to stay in school, to learn life skills, to have a stronger say about their body and their choices. And that's really the largest component of the project. We do also, within the project, focus on the supply side, both on the pharmaceutical and contraceptives, but also the human resources for health and the availability of healthcare workers in rural areas. And we are supporting a concept that is called the rural pipeline, which basically looks at recruiting healthcare workers and providing training institutions in areas closer to where they would practice in the end, rather than bringing practitioners into the capital and other big cities where typically then people create their lives and stay and find it difficult to return to the more rural areas where they're very much needed. And the third strategy is around the political commitment, providing legislation that can promote and support women's and girls' empowerment, that also involve various leaders, including religious and traditional leaders who have a very strong influence on the decision-making in the family. And so those are the 3 main strategies, and we can discuss a little bit more in detail any of them.
Thank you, Margareta. And you've mentioned, just to start with, traditions and how some of these programs that you've instituted, such as education, young girls' empowerment, and how do you work with the families overall in terms of changing these social norms, traditions? Could you kind of tell us a little bit more about that?
Yeah, so within the project, we set up a process by which several ministries collaborated together to develop proposals for women's empowerment initiatives. As a first basis, we looked at the evidence. What do we already know about the decision-making process? Who is the decision maker at the home? Who are strong influencers, and so on? And on the basis of that, what can be done to support and empower the girls in that decision-making process. Now, the 6 countries will be implementing 19 women empowerment initiatives. Several of the countries, 5 out of the 6 countries, will be setting up what we call safe spaces for girls, where girls will be offered a vocational training where they will be exposed to a female leader who will provide a number of different opportunities, but also really talk about the body and how it works and so on. There are other ways that government can really support the process, supporting programs that bring girls who are out of school back into schools, that create a safe environment for girls to go to school, whether it's providing transports, girl-specific buses, or ensuring that there are toilets for girls and boys separately. And so first, I think and we would need more research on this, but it's to try to really understand the communities and the specificities in each one of the communities, and then at the government level try to support and develop projects that would support the target groups within those communities.
Quentin, turning to you, from your research, what have you found as kind of the drivers behind child marriage in both kind of urban settings and rural settings? What do you find in terms of the kind of the pressures?
Well, so if you look at the basic facts, right, you would know that child marriage is much more prevalent in rural areas than urban areas, and also among the poor than the population as a whole, right? So practically, there is really a choice between going to school and getting married, right? Niger is a very good example, one of the countries in the project of Margareta. Niger is the country with the highest incidence in the world of child marriage. It's about 75% of girls who marry before the age of 18. And you have about 40-45% of girls having a child before the age of 18. Now, once a girl leaves school in Niger, essentially she becomes married. And the reason why is because the context is such that parents do not want adolescent girls who are in age of having sexual relationships to be doing whatever they might do if they are not in school. And so there's a lot of pressure to avoid the risk of a pregnancy outside of wedlock for the girls to really get married early. There's also a whole structure of gender roles, if you will, where many girls actually do want to get married because it's a way to get a bit more autonomy. There is very nice qualitative work done under the sweat again that shows that sometimes the marriage is forced in the sense that parents would force a girl to marry when she wants to continue to study, but in many other cases it's not. And the whole culture, the whole role that young girls have in society and the fact that they are seen mainly as mothers at home, even if they work and do production at home, leads to that early marriage, right? So that also means, in practice, that probably the best way to delay marriage is actually to keep the girls in school, which then can require all kinds of different interventions. I mean, Margareta mentioned transport, right? If you take a very large country like Niger, sometimes the secondary school is too far, right? So how can you get there? Or alternative forms of schooling. Conditional cash transfers have been suggested as a way to keep girls in school. But there are twists, and one of the nice evaluation that was done by our colleagues at ICRW was a project in India that was specifically designed an intervention by the state of Haryana to delay the age of marriage by providing a cash transfer at 18 if the girls would not get married before 18. And what they found is that it actually didn't delay child marriage that much, and a lot of the girls got married at 18 and used the cash transfer for the marriage. And so what this points to is that you need those interventions to keep girls in school, to delay marriage, but you also need to have something at the level of the community so that it becomes accepted and encouraged for the girls to actually delay the marriage. And that also relates then to all of the issue of the type of work that young women can do in those countries, the type of benefits from higher education. I mean, can they get a formal sector job? Can they get even an informal sector job that pays well, that warrants investing in the education of the girls? And so what I'm trying to say here is that you need to have very specific interventions, but you also need to have something at the level of the community to try to break the tradition and the social norm of marrying early. So again, I mean, the context is different in different countries. And this morning, just to give another example, we had a question about one of the impacts, which is the social isolation that sometimes a girl who marries very early can be trapped into, right? And that can be the case in some countries where, for example, you would have 10, 15, 20% of the girls marrying early. In a country like Niger, where 75% of the girls marry early, it's not clear that early marriage would lead to social isolation, right? So again, you have to try to understand those impacts and the intervention in the country context. What is clear also, maybe that's the last thing I wanted to mention as basic numbers, is that in a number of countries, the practice of child marriage is decreasing. But if you look at the world overall, we have had a decrease of about 10 percentage points in the developing world in the share of girls marrying early in 30 years. That's not very fast, right? And this is why we believe that you need specific interventions, both to delay marriage, but also, and coming back to the SWED, you are not going to end child marriage right away. And so you need also a lot of services for those young women to be able to manage sexual and reproductive health, for example. And a lot of what is done under the SWED, some of it will delay marriage, but some of it will also provide a range of services, including life skills, access to contraception and others, so that those girls who continue to marry early have the services that they need.
Thank you, Quentin. I mean, it's interesting that it is, there is progress, but it has been slow. And even if we look, I mean, ourselves, we look at the legal dimensions. And so we see that, I mean, in our data, for instance, there are 158 economies across the world which make 18 the minimum age of marriage, but then 3/4 of those still allow earlier marriage, like for exceptions, parental consent or kind of pregnancy. So I'm wondering, I mean, how would you say that, at a government level, what would be the policies that would be needed to shift these kind of norms? And what kind of economic case can you make for that, Quentin?
So, I mean, again, RSRW was a pioneer of work in this area, and they classified policies in 5 groups. I hope I remember them. But one was the legal framework, right, which is a necessary and not sufficient condition, right? But it sends a message, which is important. 2, policies to empower girls. 3, policies to keep girls in schools. And of course, I said 4 and 5, and I have to remember what that is. But the fourth was interventions at the community level, which, for example, would include dialogue with faith leaders who have actually a lot of influence. And sometimes, especially in Islam, you have a perception that child marriage may be recommended. Or marriage early at least is not forbidden at all, right? So these community and religious leaders actually have an important role to play. And then the last one, I forgot exactly what it was. But so you can see that there's a complexity of programs and policies that you have to put in place. The legal framework, since we are now in Law, Justice and Development Week, is important, but often nothing is enforced. And it's very difficult, you can imagine, for a country where, say, even 40% of girls get married before 18. How are you going to enforce that? There was an interesting blog a few days ago by one of my colleagues from the gender unit at the World Bank, who was talking about the potential of something as simple as providing an ID card to young women for them to be able to say, well, I'm underage, so I should not get married. I mean, I don't know how large an impact that could have, but there's a wide range of interventions that could be done. But I think, again, for the delay of the age at marriage, the keeping girls in school is probably the most important one, with the various types of reducing costs, providing accessibility and all of that can be done.
If I may add to that, I think one word that we will hear a lot about next year in particular is the demographic dividend. and the idea of changing the population structure in countries. So in countries with a large number of dependents on the working population, it's very difficult for the economy to grow. And there are many countries, specifically in Asia, that we've seen where countries have been able to undertake policies that have curbed the number of dependents, and then benefited from a period of economic growth and opportunities that benefit both men, women, the household, but also really the greater economy. And many countries have become more and more interested in seeking support for embarking on a journey that would trigger a demographic dividend in various countries. And the Africa Union has made 2017 the year of the demographic dividend and youth. And I think that we will see a lot of discussions around that. And that's many of the policies that Quentin mentioned. And of course, these policies could be done separately, but it's really important that they are done in some coordination so that you can really try to trigger and move the country towards this period of economic growth. And that's a very attractive conversation, of course, for ministries of finance and other members of government who clearly will have a main objective in seeing their country grow economically.
So Tazeen, let me add one thing, because you reminded me of that, which is very important. I mentioned that when we compute the economic cost of child marriage, right, the economic value of ending child marriage, it was in the hundreds of billions of dollars per year, right? The largest chunk is through the fertility effect, through the demographic dividend. That is the largest economic benefit that would arise from ending the practice. There are also benefits from higher education, lower mortality for children, and all of that, but the biggest one is the one that Margareta mentioned.
So I think this is a good time now to turn to you to see if you've got any questions. So I see this lady at the back and a couple of questions at the front. So perhaps we can start with the lady at the back.
Hi, my name is Pearl. Thank you for sharing how early child marriage has an impact on the economy. My question is twofold for both Quentin and Margareta. There's two things that are not clear from both of your explanations on the impact on the economy. Today, our focus is on connecting for climate change. So Quentin, you did mention about data collection. Can you please expand a little bit and explain specifically how data has been collected, research, so that you could reach the assumptions that you have? And for Margareta, on the population side, how then are things being implemented to bring the idea of child marriage full circle to how it affects the climate in the economy? I'm not understanding from your explanation the clear connection. You're not making that clear connection. Could you make that connection, please?
So we are collecting some new data in 3 countries, but most of the estimates that I mentioned are based on existing data, such as demographic and health surveys in particular, and other sources of data like living standard measurement surveys and so on. So the estimates are obtained from looking at the impact at the margin of marrying early on the health of the woman, the health of her children, her education level, the number of children that she has, and whether she works or not, et cetera, right? So we are using advanced econometric techniques to look at the impact of marrying early, controlling for many other factors on all of those outcomes. And from that, we can actually put a cost on many of those, and that's how we come to our cost estimates that we hope the ministers of finance or ministers of health or education will see and then say, oh my God, we have to do more about this issue, right? Because it really matters for development. We haven't actually made a link so far between the issue of climate change and the issue of early marriage. And so I could say one thing which is a pure conjecture because we haven't done actual estimates. But it is clear to me that weather shocks that come from climate change have dramatic negative impacts on households, and that often households have to make decisions to try to cope and adapt to those shocks. And for example, I did 2 studies, one for the Middle East and North Africa, one for South Asia, about the impact in one case of drought and floods and the other one on cyclones on households, which are both likely to increase with climate change. And we saw that in some cases, for example, parents were taking their children away from school after being hit by a drought or after being hit by a cyclone, because they didn't have any means to keep the girls in schools. Then indirectly that, for example, could very much lead to much higher rates of child marriage. And we have seen the same kind of pattern, although I don't have strong data, but certainly quite a bit of anecdotal evidence, including articles in the New York Times and others, whereby, for example, the crisis in Syria has led among some of the refugees and other cases in a larger number of girls marrying early, right? This has been reported at least on. And so all of these negative shocks on households increase vulnerability and often have or may have as a consequence a higher likelihood of child marriage. And so in that sense, there may be a link there, but on that part we haven't done detailed technical work.
Margareta, can I turn to you?
Yeah, so within the project itself, focus has been put on regions' specific vulnerability, including some of the border regions where there's migration, sometimes caused by drought and other climate effects. And thus the regional aspect also of the project. It's 6 countries where there is a large amount of migrating populations, and so that there should be coverage and specific focus on those groups. I think beyond this particular project, the bank is also looking at the type of services that we can provide for refugee groups as a whole, and specifically the healthcare services to young girls, to women who may not be living in their own nation. And this is something that the bank is scaling up, both in terms of its technical program, but also in terms of its financial support. So that goes beyond this particular project. But within the SWED project, there has been a focus specifically targeting the regions that have a lot of migrating populations. Now, there's a lot of colleagues in agriculture as well. Of course, I'm sure you've heard about this, who have major concerns about food availability. And I think, again, it's important to work beyond sectors and across sectors to look at connecting the effects when we talk about the early marriage and the high fertility and the pressure that it puts on specific regions, and then migrations that probably will continue to grow in number over the coming years because of climate change and other factors.
Do we have time for a couple of other questions? So maybe we could take 2 questions together. I think there are 2 questions at the front. Yeah.
Hi, my name is Garam. I'm from Syria. Thank you for the very interesting presentation. I work with Tazine actually on the Women Business and the Law project. So I wanted to ask Quentin about what are the best intervention mechanisms to be introduced in a country where religious leaders play a role in child marriage. I've worked on countries where a religious person can conclude a contract outside of court and it is registered in court, and I've talked to judges in these countries and they tell me if a girl comes to court at the age of 14 and she has a religious contract that is concluded by a religious leader and she's pregnant, I have to register her marriage, I have to make it official. And these religious leaders enjoy full immunity from penalty, and it's very difficult to kind of take them to court and penalize them for their actions. What do you think from a practical point of view are the best intervention mechanisms to prevent these actions from happening in these countries? Thank you.
And maybe we take a second question together.
Hi, my name is Danielle. I was wondering about, since you talked about empowering girls, what you do to empower the women who were married into this at a young age and now are seen as the dependents in their society, what they can do to gain some independence and help out in their society.
Okay. Both great questions. So I can turn to both Quentin and Margareta. If you want to answer both or one, I'll leave it up to you.
So let me try to give an answer very briefly to both questions. We don't have much time. So the question of the religious leaders is a complicated one. You cannot force it. You have to find a way to enter into a dialogue, including about what Islamic law says about marrying early. And there are a number of programs that are trying to do that. We published about a year ago a special issue of a journal, Review of Faith and International Affairs. And one of the articles was about a program like that in Nigeria. And what I found interesting about the conclusion of the article, it was a relatively small sample. It was, I forgot, but less than 100 faith leaders that had participated in the program, was that you could not actually convince the faith leaders that Islam, in that case, if you take that religion, prevents child marriage. But you could have a very good dialogue with them about the consequences of the practice and the impact that it has on the girls and how to improve their welfare and their status, their education, which are all also objectives that the faith leaders often share, right? And so I think often you have perhaps not to go about the religion itself, but more about what we're talking about, which is the economic impact. But I don't know what will happen under the SWED. They have an idea of discussing with the faith leaders and having that dialogue at the community level. It takes time, it takes resources, but I think that minds may actually potentially change, right? And we have seen that in other cases like female genital mutilation, for example. Now, or maybe I should stop here, not to take too much time.
Well, I mean, this is a very interesting question, and I just want to briefly mention that the 6 countries in the SWED project are looking at launching a regional network of religious leaders, potentially also including traditional leaders, who would become advocates of safe and healthy practices. And the way they are thinking of doing this is to really do a mapping of those leaders who are already active in communities and empowering them and working with them. Al-Azhar University in Egypt has already done several teachings on this, and actually I think interfaith teaching, both on Muslim and Christian, where they've reviewed the texts and looked really at positive aspects that can be brought forward, specifically around healthy behaviors. Again, these are very sensitive issues, but there are leaders out there who are proponents, and I think what we're hearing is that they would like to play a more active role in this. And so within these government-led projects, looking at how to best collaborate with the religious leaders, first of all, understanding who they are out in the communities, and then empowering them in being advocates for these messages.
So on your questions, if I may, because we didn't reply to your question, right? So what do you do for the girls who already got married early to empower them, right? And so there's a lot of evidence on programs that either do life skills or do even entrepreneurship skills. The bank had a large initiative which is called the Adolescent Girls Initiatives for a few years that achieved quite a bit of impact, including for girls who had children in terms of their employability. One idea that I found very interesting, I just want to mention it, and the name of the person, Daniel Perlman, who is at Berkeley and actually again worked for the SWED. So he did with colleagues very in-depth ethnographic work in Niger, not focus groups like we often do. No, they actually lived in the villages for many months. And one of his idea in terms of action that can be done for the girls who already dropped out of school, may have married or not, is to have almost an equivalent of a school, but for life skills, for understanding what to do with a microcredit, for entrepreneurship's idea, etc. And he was actually saying that the girls should have a uniform. The girls should be in that school for a certain number of hours per day. So it's not a formal school, but it would be then recognized by the community as something almost equivalent and would then get much more support from the community. And parents, for example, might be willing, even if the girls dropped out of the normal formal school because there's no school, let's say, to send the girls there and not marry her right away because she's in a program that is sufficiently strong and structured, right, as an an alternative to formal schooling. So some of this can also be for girls who did marry. So there are a number of ideas, and the good news is that we have many more impact evaluations coming up, and some done in recent years, that show the impact of those kind of initiatives.
Okay. Well, sadly, I think we have to wrap up now. I did notice there was one more hand up, and so I think I can speak on behalf of Quentin and Margareta that you can approach them after this session. But I will kind of now say thank you very much to both Quentin and Margareta for a really interesting session.
Thank you.